Welcome to Doc Talk here on the medicaltvchannel.com. I'm your host, Michael Ray. It's your opportunity to talk with a doctor. Any questions or concerns you might have, you can send them through us right here on the medicaltvchannel.com website. Two opportunities there on your screen. You can either use the live chat or you can use old school email. Either way, you can pass questions to us and we can go ahead and pass them on to a doctor. Today we're talking to Dr. William P. Adams. He's an associate clinical professor of plastic surgery at UT Southwestern in Dallas. He also has his own private practice in the University Park area. Doctor, thanks for taking some time today. How long have you been doing this? How'd you get to become such a celebrated plastic surgeon?
Well, that's very kind of you, Michael. I actually have been here in Dallas for over 20 years. I did my university training at Prentice University, and then I went to Vanderbilt University for medical school, and then I came to Dallas to do my general surgery and plastic surgery training, and then went into practice in 1997 and was at UT Southwestern Medical Center full-time, and now I'm transitioned to part-time at the university and in my private practice, which is based in University Park.
Let's get right to it. A lot of different things that you've no doubt seen change over the years, in the years that you just mentioned. What's different? Are there myths that people think are the way things are and they truly are not, that they have changed in your field?
Absolutely. You know, back when I was growing up, I think plastic surgery was really felt to be the realm of the movie stars, and if people did have plastic surgery, they didn't want to talk about it, you know, and that's totally changed, and that plastic surgery has become much more mainstream. People of all classes have gotten to accept plastic surgery much more, and it's just become a very, very popular thing from both non-surgical and surgical aspects.
Let's talk about some changes in just how invasive it is. And I know a lot of the surgery you do is, say, breast augmentation. If somebody were to choose that procedure, is that where you have to kind of take vacation time, plan out a couple of weeks away from work to lay on the couch in recovery, or where's that at right now?
Yes, you know, what we found with really advances in breast augmentation has really revolutionized the whole experience of the patient. So many patients experience a recovery for breast augmentation that can be 1 or 2 weeks, where they can't raise their arms above their head. But what we found with many of the outcome studies that we've done is that you can really have a very fast, quick, easy recovery with breast augmentation. So using these techniques now, our patients typically are out shopping the day of surgery, out to eat dinner the night of surgery, and really with minimal pain and discomfort, and back to their jobs within 1 to 2 days.
It really is an amazing time. Here we are chatting back and forth with you on the web. I want to remind folks who are watching us on medicaltvchannel.com, it's a chance for you to forward us questions via email, or there on the screen you can see the live chat box. Doctor, as far as the changes go, folks like to find out information on the web these days. I'm sure you well know that. Do you see people researching a procedure before they even come to talk to you about it? Do they already come with a certain amount of knowledge, and how much of that is accurate?
Absolutely. It's incredible how much information is on the internet, and patients really have embraced that, and so much to the fact that, unfortunately, with the vast breadth of knowledge on the internet, a lot of that sometimes is misinformation. So for patients, the key is trying to get a source that's credible and that they can trust. And we see that a lot in our practice. As a matter of fact, I have one of my staff members is a dedicated patient educator, and she spends a lot of time talking to patients and educating them about the procedure. But what we find is that a lot of times patients have found out a lot of information, but some of that information may not be totally accurate. So we spend time trying to determine what the patients know, and then redirect them if necessary, so they really can know as much as they possibly can about any given procedure.
Speaking of which, there must be several procedures available to the patients these days. What other things do you do? What other advances have you seen?
Well, you know, plastic surgery has really exploded in the past 5 to 10 years as far as hot topics and different advances. And you know, you can look at, we've already talked about some things in breast augmentation, but if you look at body contouring, advances in liposuction. There's a lot of new technology as far as fat removal, non-surgical fat removal, even the talk of potential lasers removing fat. There's been incredible advances also in just non-surgical things. As you know, Michael, the most popular thing that's done in plastic surgery is Botox and soft tissue fillers. And there's been an incredible advance, particularly in the United States, of having new fillers and new botulinum toxins that patients are really able to benefit from.
Let me ask you about that too, because obviously you know much more about it. I think even if you follow things like this in the news, there's still a lot of misinformation about it. You just mentioned two things. Botox, has that changed from when it originally came out? Is it the same procedure? Or I would imagine there are some advances there as well.
Yes, Botox or botulinum toxin, as it's called, is not. It's a little bit of a misnomer. It's not really a toxin per se, but it's a compound that has been used since actually the late 80s in various aspects of medicine. It was originally used in patients who had an issue with their eyeball movement, strabismus it's called, and also patients in their vocal cords. And then in the early to mid 90s, it really started to gain some acceptance in the cosmetic surgery application. And so, as you know, patients may have lines such as their forehead or around their eyes or in between their eyes that make them look like they're frowning. And what Botox can do is it can actually relax that muscle to smooth that wrinkle and truly give the patient a rejuvenated look. And so, Botox has been there's different types, but basically there's been one particular manufacturer has had almost a monopoly on Botox market for many years. But now there's actually some new ones that are coming in to the marketplace, and the techniques for injection have also been advanced as well. So overall, it is an exciting area, and as I say, it's very, very popular. One of the most common things that plastic surgeons do.
When we went over this category, you mentioned not only Botox but fillers. Is a filler a type of Botox? Are they two different things? What is the advancement there?
Yeah, that's a great question. So soft tissue fillers are actually different from Botox. What we know as people age, if I look at myself as when I was 15 years old compared to now, you notice your face loses volume. And so one of the key aspects of rejuvenation is actually to restore volume. And so that's what soft tissue fillers are. There's different types, but they all have the same theme in that we're trying to restore volume to the face in areas that people lose it. So typically, you'll see patients that may have lines in their nasolabial fold or in their cheeks or their lips, and as they are seeing some of the aging process start, they can see some of those areas lose volume, and that can manifest as a crease. So a crease in the cheek, as in the nasolabial fold, that gets deeper as somebody gets older, or their lips tend to be a little bit thinner and they want to have fuller lips. So the fillers that we use are able to restore volume in that area and just gives a patient a rejuvenated look. But the nice thing about that is it's a non-surgical thing. It's done in the office. There's minimal recovery, and tolerated very, very well with very minimal pain to use those products. So they've been definitely a big advance and something that patients really like.
We want to remind our viewers once again here on medicaltvchannel.com, we want you to be part of the conversation. There on the webpage you can see a chat box over to the left. You can type your question in there, or if you want to do it old school, if you will, you can also do email there on the page. Let's go to the chat box. Doctor, there's an interesting question here, and it's kind of a technical question. What do you think about the transfer of about fat transfer in breast augmentation? What number one, for those of us who don't know, what are they talking about there, and what do you think about it?
So fat transfer is basically taking fat from one area of the body and then placing it into another area, and it's something that we've done in plastic surgery for many years for various different applications, but typically in reconstructive type procedures where there's say, a soft tissue deficit or a contour irregularity, that you can take fat from one area and inject that into another area. And usually you have about 50% of that fat that will survive long term. So it's a technique that we've used successfully for many years. Now, the story gets a little bit more controversial when you start talking about injecting fat into the breast, and we'll talk more in terms of cosmetic breast surgery right now. But for, say, breast augmentation, it's much less proven right now what the actual, number one, efficacy or success of injecting fat in the breast, and then probably more importantly for the patient, what the actual safety of injecting fat into the breast is. And so it's really an evolving area. I chair the Hot Topics Forum for our societies, and every year, we have some presentations on that. And right now, it's really what I would just term an evolving subject. So it's not something that I certainly would recommend to any patients until we have more scientific data to say that this is a viable option for a breast augmentation patient, and it's something that's safe and is not going to cause interference with the detection of a breast cancer or have other issues. But I think in the next 3 to 5 years, we'll have more and more scientific data, and we'll be able to advise patients accordingly regarding that particular modality of treatment.
I want to circle back to that in just a moment. I like the fact that you're talking about hot topics. We'll get to that, but right now we do have the viewer questions here via the chat box. Here's another one, and it's about what we talked about earlier in the program: 24-hour recovery from breast augmentation. Is this common? Do all plastic surgeons do this? Is this something that you've kind of led the way on? Where are we in medical science right now with this? Is it more common than not, or is it something you've, as I said, led the way on?
Well, I think that I certainly have been a proponent of that. There are, I would say, it's an evolving technique. I would say there's not that many plastic surgeons around the world that actually practice what we term the process of breast augmentation, or what needs to be done in order for patients to have a 24-hour recovery or a fast-track recovery. But it is something that multiple surgeons around the world have done and had patients who have been able to realize that type of recovery. But I think it is an important indicator of the actual quality of the procedure that's being delivered. So I think that it is an important recovery, is no doubt a good indicator of that. And so for the surgeons around the country and around the world that are practicing the techniques that allow patients to recover like that, I think it also translates into other things that we know that patients benefit from, things like less reoperations, less complications, and again, a better overall experience with the procedure.
I guess that just makes common sense for laymen out here that, less is more in this case. It's certainly better. You also mentioned liposuction before. Is that what it used to be? I know that there was talk of people being laid up for some time and not being able to be active for quite a while after that. Has that changed these days?
The techniques for liposuction definitely have evolved in the past 20 years. 20 or 25 years ago, again, liposuction was not really a mainstay plastic surgery procedure. I think there were very few plastic surgeons that actually embraced that as a technique, and now I would say virtually all plastic surgeons do liposuction commonly. And the techniques and the technology is clearly evolving. I think that has translated into patients being able to, number one, have quicker recoveries from liposuction and better overall results. So, and I think that's, again, an evolving thing. In our Hot Topic session, fat removal, whether it's through surgical means or non-surgical means, is always one of the most common presentations that we have. And liposuction remains, as we talked about, breast augmentation recently has been the number one surgical procedure, but liposuction is always very close behind, is either the second or third most common plastic surgical procedure.
You just were talking about that Hot Topics once again. What other types of things do you hear? I mean, there must be a lot of questions out there, and as we say, you've already today during the program shot down some myths. What comes up in these types of sessions?
Yeah, it's actually they're very well received and attended session because, as you say, there are a lot of myths in plastic surgery, and unfortunately, with the way marketing is and what in the internet, a lot of times there's things that get marketed or get hyped before there's any really scientific validation of whether they're a good thing for patients or safe for patients. And so we see a lot of different technologies come through the hot topics forum. I'll mention a couple other ones, but one is, there's we were talking about liposuction. There's these laser liposuction technologies, again, that have been marketed very heavily as, the next best thing in liposuction and body contouring, where somebody can just have a little laser fiber placed into their whatever fat compartment, and the fat can easily be removed with much less recovery and better skin tightening. And so that's obviously has a big appeal to a patient or a potential patient that's looking at a body contouring procedure. We've looked at this in Hot Topics, and what we found is that there's really not a lot of scientific data right now to say whether or not this is a better or an advancement in liposuction. So that's really where the buck always kind of stops, where the science rests. And so it is really just an evolving topic right now. There is very little scientific data to necessarily say that new laser liposuction technology produces any better result than standard liposuction techniques. And so that's something that we're all looking at from the scientific perspective to determine if those laser type liposuction technologies will be implemented into common clinical practice. But right now, I would just say basically the jury's still out on that topic.
Is that part of the work that you do when you're at UT Southwestern? Do they intertwine pretty seamlessly, or how does that shake out for you?
Well, my research interests have been in breast implant technology, breast implant aging, and then patient outcomes in breast augmentation. So that's really where my main research has been in. But we do have several very close colleagues that actually are researching the laser liposuction technology that are also at Southwestern and other areas of the country. So that's not necessarily my own personal research focus, but it is being researched here in Dallas.
We've spent the better part of the half hour talking about the physical aspects of this, the medical aspects, if you will. How about the mental procedure? There must be a reason why this is so popular. When you talk with patients, do they feel better about themselves, or are you helping in that regard as well?
Absolutely. If you look at different studies that have looked at patient outcomes in plastic surgery, the number one thing that's seen is that patients have equivocally almost all a bump up in their quality of life following plastic surgery procedures. So not only are they satisfied with their procedures, but they feel better about themselves, and that translates positively for them for the rest of the things that they do in their everyday life. So that's it's actually a great thing being a plastic surgeon, because it's fun in the sense that we it's different from maybe when I was doing trauma surgery and general surgery. You're truly saving sometimes people's lives due to traumatic events, but in plastic surgery, I can tell you we can have some very significant impact positively on people's lives with these different procedures that are being done, and patients are thankful for it, and it makes you feel good to be involved with that.
The process leading up to it, I guess people probably give a great deal of thought to this beforehand. Once they do, before they even contact you, then they probably want to, once they decide to make the change, they want to do that quickly. How does that all proceed through the office, and what's the timetable on that, generally speaking? I know every case is a little different.
Yeah, well, we actually, it's interesting because patients tend to research things and think about things for even years. And I've seen a lot of patients have thought about a procedure for 2 or 3 years, and then finally make a decision they want to come in and have the procedure. And usually by the time they decide to do that, a lot of people kind of want to have it the next day. So once they make that decision, it's a quick one. But patients will call or email us. We're easily found on the internet, and we're easily reachable by phone. But the process is basically one that we want to have both my patient educator meet with the patients, and that's a very productive and well-received interaction where she will talk with patients. She's very knowledgeable, very approachable, and patients are able to learn, certainly from our practice philosophy about their specific procedure they're interested in. And then at the same time, they're scheduled for a consultation with me where we can meet, discuss the procedure, my recommendations, and any other questions the patient may have. And we, our practice certainly is set up to make that experience in plastic surgery as positive as it can be for the patient. So we actually like to not have patients wait a long time. We want to get patients in as quickly as possible based on when they want to be seen, and we find that really works very well for our practice and our patients.
Dr. Adams, we've taken the questions from the web. I've asked a few questions as well. Anything we haven't touched on today that you wanted to point out? Are there any areas where there are still questions?
Well, I not specifically. I think that the only thing that I would any patients that are listening out there or are considering a plastic surgery procedure, the one thing that I would leave people with is that it's really important to do your homework. If you're going to consider a plastic surgery procedure, you really want to look up and make sure that whoever you're going to consult with is board certified by the American Board of Plastic Surgery. It can be very confusing about different people with different levels of training that profess to perform cosmetic surgery. But it's only true plastic surgeons that are board certified by the American Board of Plastic Surgery that have gone through the accredited extensive training programs, extensive examinations to be board certified, and that really translates into your well-being as a patient and ultimately giving you the best outcome you can be. So I think that's really, a really important thing for potential patients considering plastic surgery.
Dr. Adams, you've been great with your time. I know you're busy. I appreciate the visit here with us today. Thanks a lot.
Thank you very much, Michael. Great to be with you.
And for those watching on medicaltvchannel.com, if we didn't get to your questions via the chat room or the email, just notice at the bottom of that page there's a section where you can contact the doctor. You can contact Dr. William P. Adams directly. If you have further questions, concerns, and whatnot, send them there and he'll answer you via email, and perhaps we can move you on down the line. Thanks again for watching medicaltvchannel.com. I'm Michael Ray.